Hello, Dr. Koen here. Greetings from Washington State. Although I'm no longer physically on the island, I have continued working closely with the OMT and keeping an overview of the COVID-19 situation around the world and also around Saba. Dr. Willemijn will take over my role as public health doctor in the period to come. So I am here to explain a bit more about what does moving to mitigation mean. It basically means a switch from having measures that completely keep the virus out to measures that keep the virus under control. So does this mean COVID is over? In a word, no. Unfortunately, there will be no over for COVID. On Saba and around the world, it will follow a natural movement from pandemic to endemic. And what that means is that the virus will be forever part of our lives. For example, this evolution from pandemic to endemic is similar to how the Spanish flu of 1918 has become one of today's common seasonal flu viruses. In mitigation, Saba will loosen some of the restrictions, and the island can therefore expect that there will be a low level of virus circulation. Saba will still have procedures and measures in place to prevent large outbreaks that could overwhelm the healthcare system. On Saba, with our high vaccination coverage, the disease burden for vaccinated people and young children is expected to stay relatively low and comparable to other respiratory infections. For unvaccinated people, they are still, however, at higher risk for severe disease, and we strongly urge them to still get vaccinated.